So let's look a little bit at strategic value. We're going to, I like to align the strategic value of these solutions with the triple aim framework developed by the Institute for Healthcare Improvement in Cambridge, Massachusetts. You're all probably familiar with the triple aim. It is an excellent framework, really describes an approach to optimizing health systems performance by simultaneously pursuing 3 goals. Those include improve the patient experience of care, both in quality and satisfaction, improve health of populations, and reduce the per capita cost of healthcare. Ambitious goals, but as Erin mentioned before, with the shift to value-based care, this is going to become so much more important and crucial for organizations to be able to achieve the triple aim. So let's look at 3 main aspects of that. The first is quality improvement. It's a pretty broad category there. But we can see that it significantly impacts 2 of these triple aim objectives, improving the patient experience as well as improving health of populations. It can also reduce the cost, but we'll see how others impact that probably more. Really, we'll focus more on the patient and populations here. We want better outcomes. We want the patient to have the experience that they're looking for, that meets their expectations, that they feel safe, and they feel cared for, and they feel like they had personalized medicine. And this really goes to the value-based care as well. So it's not about quantity anymore, and it's about quality. So that shift has to be made, and the focus has to be on that. Operational efficiency. So improving operational efficiency will be essential to reach the objective of reducing the per capita cost of healthcare, minimizing resources and time required to provide care and operate healthcare organizations. It's so simple to say, so difficult to do. There are many aspects of the operation and delivery of healthcare. The time of clinicians is particularly of concern as it impacts the care of the patient and the patient's experience. So that's one of the areas that FormFast is really focused on, is trying to minimize the clinician's time spent doing tasks that are not direct patient care, administrative tasks that have to be done, but let's minimize that so they're practicing at the top of license. We want them to be spending time with the patient and focusing on how they can better care for that patient and how they can get a better outcome. So Capture is really focused on clinicians and their experience, because really their experience is just as important as the patient. And they have quite a bit of pressure on them to do quite a few things, and it only increases. And the complexity of healthcare only increases, while the resources in some cases decrease and the reimbursements decrease. And so there's quite a challenge here. When technology can improve the experience of the clinician and actually saves them time, then it's providing value. And that's really our goal with Capture. So clinical standardization. Organizations that standardize clinical best practices can create better quality, outcomes, and patient experience, as well as significantly reduce costs of healthcare. So it addresses all 3 dimensions of the triple aim. In 2015, the Healthcare Advisory Board and Physician Executive Council published the white paper, Setting the Standard for Patient Care. adopting a clinical standardization mindset. And really this paper looked at the difference between just looking at quality improvement, which we talked about a minute ago, and absolutely needs to be a focus, and looked at, let's shift the mindset just a bit at what clinical standardization can do for us, and how maybe that would move the needle more. So so 3 primary insights that were highlighted in the white paper included. By focusing primarily on external measurements of quality, senior and board members are underestimating the importance and urgency of reducing performance variation within their organizations. So absolutely, there are a significant number of external measurements of quality that healthcare organizations have to meet. But what's happening is they're focused so much on those because they're not focusing on if we focus on our processes and the variation and reduce the variation within our own facilities, how much further that would get them. All hospital organizations, including those that are already rated high on quality, have opportunities to improve by increasing consistency across facilities, service lines, and providers. Even within one facility, how much variation do you have among your providers? And the third one was using one's own best performers to set an organization-wide performance floor will not only raise absolute performance on conventional quality metrics, but also protect margins and secure market share. So this goes back, so using and empowering your best performers to set the standard and keep that standard. The white paper mentions a 2014 study, the Industry Survey 2014, Forging Healthcare's New Financial Foundation, where the study in 2014, 55% of hospital leaders surveyed in large health systems cited care redesign as the top source of cost containment. So we're talking about reducing the cost of healthcare. What is going to be the most effective way to do that? So 2014, 55% of hospital leaders in large systems were saying this is the way to do it. This is what's going to be the top source of cost containment. Also mentioned was a 2015 advisory board poll of 34 CFOs found that the greatest potential for containing hospital costs is a shift focus from care quality to clinical standardization. So the paper compared the difference in strategic perspective based on the traditional quality performance improvement model versus the clinical standardization mindset. Concerning strategic objectives, in the traditional quality mindset, the focus is on to win bonuses, avoid penalties, demonstrate high relative performance to justify higher prices, and market to consumers and physicians. So in a lot of cases, that's a more reactive approach. Whereas a more clinical standardization mindset, much more proactive. And the focus is to win share, protect margins by setting and delivering on a uniformly high standard of care. If that standard of care is high enough and reliable enough, everything else will fall into place. So hopefully that's covered for you some of the value to think about why capture, why do I need this technology? We don't need to buy technology just to buy it. We need it to provide value to us. And we wanted to connect the value that our product can provide and with these solutions to what the challenges and the strategic initiatives that you have today.